Hi, so I'm Dr. Jay Bowden. I'm one of the hormone and functional medicine doctors here at Harpal Clinic. And today I'm going to be talking about testosterone, specifically why testosterone levels are declining. So we've known for some time now that testosterone declines across our lifespan. In particular, it declines by about 1 to 2% every year after the age of 30. But what we've noticed more recently is that testosterone levels are declining decade upon decade, independent of age. So why is this? We think that actually we know that this is to do with both lifestyle and environmental factors. So firstly, we have a much more sedentary lifestyle than our ancestors did. Instead of hunting, we're often desk-bound and working long hours. Further to that, these long hours cause stress, and we know that stress actually affects our hormone production for various reasons. Finally, our lifestyle is worse in terms of our diet. We eat more processed foods in particular, and this affects our metabolic health, which also affects the metabolism of our hormones. We have lots more toxins in our environment, particularly endocrine disrupting chemicals, which we find not only in our food, particularly due to pesticides, but also we find these in skincare products and even in things like cookware. So it's quite hard to avoid these. And even if you're very, very diligent, you will find that these creep into your life and affect your hormone balance. For this reason, we're now seeing men in their 40s who are presenting with symptoms that we would have previously expected them to be having much later, perhaps in their 60s.